anxiety is. Anxiety is a feeling of fear, dread, and uneasiness. Fear. Second, dread. Third, uneasiness. It might cause you to sweat, feel restless and tense, and have a rapid heartbeat. It can be a normal reaction to stress. For example, you might feel anxious when faced with a difficult problem at work, or before making an important decision. How do we know if we have anxiety? Let us make a test. First, I will clean the board. And now we will take anxiety test. I will ask you 10 questions, and you will answer to these questions. With these answers. Never. Two. Rarely. Three. Sometimes. 4. Often. 5. I find it very hard to unwind, relax, or sit still. Okay, so you said often on the first question. Second question. I have had stomach problems, such as feeling sick or stomach cramps. What you said? Oh, rarely. Second question. The answer is two. Okay. Third question. I have been irritable and easily become annoyed. So your answer to this question is very often. Okay. Let us continue. Fourth question. I have experienced shortness of breath. Yes, you have it, okay. So, question number 4. It is often. Question number 5. I have felt dizzy and unsteady at times. Your answer is sometimes. Fifth question, answer is 3. Sometimes. Okay, let us continue. Question number 6. I have had difficulties with sleep, which includes waking early and finding it hard to go to sleep. Your answer is very often. Okay. Seventh question. I have felt panicked and overwhelmed by things in my life. Often you have this experience. Okay. Question number 8. I have felt nervous and on edge. Alright, you said very often. Yeah. Question number 9. I have had trembling hands. What do you say? Oh, you said you don't. So, on question. Question number 10. I seem to be constantly worrying about things. Often to very often. Okay, maybe I'll say often. Now we have finished the test, and let me tell you what are the results of the test. You are likely to have an anxiety disorder. From 0 to 40, your overall score is 28, and it is pretty high. I recommend that you are speaking to a healthcare professional, to psychiatrist. Don't let your worries and fears control your life. You can get help manage your anxiety through treatments and therapeutic approaches. Let me grill the board. And let us talk now about anxiety more, because through this test we have found out that you likely have anxiety disorder. Anxiety is a common emotion. It can cause physical symptoms such as shaking, and sweating. When these symptoms and the others become persistent or excessive, you have an anxiety disorder. Anxiety can interfere with your quality of life, but also anxiety is very treatable. Let me tell you something more about anxiety. Anxiety is feeling of fear, tension, or worry. breathing. Increase. This response can help you escape or avoid danger by supplying more oxygen and blood to the muscles. However, people can also feel anxiety about things that are not dangerous, such as decisions. When you have to make a decision, important events public speaking, or on some social situations. Feeling anxious does not always mean that you have a mental health condition. Many people occasionally feel anxious from time to time, but when anxiety becomes frequent, out of proportion to a situation, or persists after the situation is over, it can be a sign of an anxiety disorder. Let me clean the board. Anxiety disorder is the most common type of mental illness in the US. However, only 37% of the people with an anxiety disorder receive treatment. And this is the problem. We have been talking about the symptoms of anxiety, and I will once more repeat them. The main symptom is a feeling of worry, but other symptoms can include elevated heart rate, faster breathing, irritability, restlessness, muscle tension, difficulty concentrating, or difficulty falling or staying asleep. If a person has severe anxiety, they may experience a panic attack, which causes an intense feeling of dread or panic. Symptoms may include hyperventilation, pounding heartbeat, sweating, or shaking or trembling. Panic attack. There are many types of anxiety. One of the type is panic disorder, which we have written here. The other is specific phobia. Specific phobias are fear of a particular object or situation, such as heights or spiders, for example. Unlike other anxiety disorders, phobias focus on one specific trigger. A person with a phobia might know their fear is illogical or extreme, but they remain unable to control it when they encounter the trigger. We also have so-called generalized anxiety disorder, or GAD. People with GAD have persistent, pervasive feelings of anxiety or dread that do not have a specific focus. It is not a response to a stressful situation that then goes away once this situation is over. person with GAD may worry about lots of things and find it difficult to relax or get to sleep. We have also one type of anxiety which we called agoraphobia, and this is a fear and avoidance of places, events, or situations from which it may be difficult to escape, or where help would not be available in emergencies. People often misunderstand this condition as a phobia of open spaces or the outdoors, but this is not the case. Some common situations a person with agoraphobia may be scared of are using elevators, using public transport, or in some cases even leaving home. There are many others types of anxiety, such as social anxiety disorder, separation anxiety disorder, selective mutism, but I will only write this for. And what about treatment for anxiety? Let me clean the board, and we will be speaking now about treatment. Treatment. It often consists of psychotherapy, medication, Sometimes a person can ease anxiety at home without clinical supervision. Things that may help a person cope include relaxation techniques, to physical exercise, 3. Getting enough sleep. 4. Reducing the use of caffeine or other stimulants. 5. We can mention talking with a trusted loved one. However, this may only be effective for mild or short-term anxiety. So it is mild or short-term anxiety. Those with more severe or ongoing anxiety may benefit from combining these strategies with therapy or medication. Let me clean the board. persistent anxiety, and ways of changing or coping with them. There are various examples of psychotherapies. Some examples include cognitive behavioral therapy, psychodynamic therapy, or some distinct forms of therapy that can help children, people who have a history of trauma, or people with specific types of anxiety disorder. And now, a couple of words about medications. Some medications can reduce the symptoms of anxiety, making the condition more manageable. Some people take medications to make it easier to begin therapy, while others may take them on an ongoing basis. Some examples of medications a doctor may suggest include antidepressants. Some antidepressants can help with anxiety, even though they also target depression. They take several weeks to begin working. Some examples are serotonin inhibitors or fluoxetine. Then we have beta blockers. These drugs do not stop anxiety, but they do reduce the physical symptoms associated with it, such as a rapid heartbeat. People can take them over a short period of time, or only occasionally, for anxiety-inducing situations. And the third medication that I will suggest is benzodiazepine. These drugs act immediately to reduce anxiety, but they can quickly cause dependence or addiction. result, doctors only prescribe them for short-term use. Diazepam or Valium is a common type of such a medicine. Some drugs work better for certain types of anxiety than others. So people should work with a knowledgeable mental health professional to find what works best for them. And one more time, it is important to note that some of these drugs can cause side effects, including even a worsening of anxiety when a person starts taking them. It may take even several months for these to subside. At the end, I want to mention that as our videos can also help in fight with anxiety. Find your favorite ASMR artist or a couple of them and watch these videos and relax.